Hello, everybody. Thank you for allowing me to be here today. My name is Lisa McNeil, and as Beth said, I am a patient, and I'm also the chair of the Aspergillosis Trust charity. Those eagle-eyed amongst you will be able to see that I am actually coming to you from my hospital bed today. So I thought I'd just start a little bit before I start talking about how we support patients, about who we are, really. So as you can see from here, we're a very small group. There's only 5 of us legally involved in the charity. And then we are very lucky to have 2 administrators, Mick, who you saw before, and Soraya, who both help us with our Facebook page and do some overseeing on there and some safeguarding and some administration for us, which is great. So this is just a little bit about the charity, our story, our vision, our mission. So we became a charity back in 2021. We are a not-for-profit patient-led organisation. And now really our story is that we are aiming to raise awareness of aspergillosis. We want to support patients, both new and existing patients across the globe, who has either been recently diagnosed with aspergillosis, and as like Marcia pointed out before, what? People say, what is that? Never heard of it. And those who've been dealing with it for a long time and are dealing with complications or just getting quite disheartened. So we're there to support them. Our vision and is to basically to get aspergillosis recognised as widely as possible by healthcare professionals, members of the public, and help patients get the diagnosis that they need sooner rather than later, which we hope will improve outcomes for all patients. But how do we achieve this? But in order to achieve this, first and foremost, we need money. So the first slide that should be coming up should be talking a little bit about the fundraising that we've been doing. We've been very fortunate over the past number of years to have some fantastic fundraisers. There's just a snapshot of some because I couldn't possibly fit them all on here. But these are just some of the highlights. We've been really lucky to have, over the past 2 years, 10 runners in total running the London Landmarks Half Marathon for us, 10 running the Royal Parks Half Marathon for us. And if anybody out there knows what it's like to be a charity, if you've not had a London Marathon place, that they've been impossible to get. And we've been lucky enough to be given 2 places for the 2026 marathon. So we will be looking for some avid fundraising for that. We also had a team of 15 guys, Mammals, I think they're called, who cycled from the Blackpool Tower to the Eiffel Tower for us, and they raised a significant amount of money. We had a family in Belfast who ran the Belfast Marathon in memory of their wife and mum. And again, that fundraising was phenomenal. And then one of the highlights is we had one of our patients and his family over in Ireland attempted to walk the 7 highest mountains in Ireland, and they wanted to raise money specifically to create children's literature. And what they noticed, one of the things they were dealing with was trying to explain this to the younger members of their family, to their grandchildren, and they were really struggling. There was very little literature out there, very little to help them. So we're in the process of having a children's book written. It'll be very colourful, and it'll have a lot of information in there that is aimed primarily from sort of 5 to 9-year-olds, and aimed at helping them not only understand the lungs and lung health, but also how aspergillosis fits into that. So we're really looking forward to that coming out. And then another way of raising money is obviously through merchandise. It obviously doesn't just help raise money in the same way the fundraising doesn't. It helps us to raise awareness, and that's a real key message for us. And if anybody is interested in having any awareness materials, please contact me, or you can go to our online shop, which is on our website. Just simply go on there and purchase in the normal way you would purchase online. You can use these items to help raise awareness. We have a monthly giveaway on our Facebook page now, and a lady recently won a mug and gifted it to her GP. So he's got it on his desk as a gentle reminder of the fungus. And then at Christmas, one patient purchased 10 pens to give out to all his colleagues as a way of keeping them all focused on his condition. So this stuff can be used wisely. I find that I give a lot of it away. In fact, I've been giving it away in the hospital today. So there's plenty of people in here wearing badges and pins. How do we support patients? Well, in the same way that everybody else does, we have social media. It has its negatives, but it has its pluses too. And so we have a Facebook page. In fact, we have 3 Facebook pages. We have a Facebook page, which is a closed group. You need to have aspergillosis or be looking after or caring for somebody with aspergillosis to join that group. We also have a public group that's out there, and then we have a family and friends group as well. One of our trustees is not a patient of aspergillosis, but her father was, and she felt that there was often questions that she wanted to ask as a family member that she didn't deem it would be appropriate within the group. So that Facebook page was created, and that's there as well. We have an Instagram account, Twitter, X, whatever you want to say, account, a YouTube account, and a website, aspergillosis.org. One of our biggest support tools really is the Facebook support group. We've got over 2,000 members across our Facebook groups, of which 852 of them are very active according to the analytics. When I was putting this presentation together, I did a little bit of a trawl through where our patients were coming from, and we had over 10 different countries, but the majority of our patients are actually from the US of A, with a really high percentage, something like 65% of the members are from the USA. We have an average member from 18 to 80, with the average age being mine, 45 to 54. I'm not telling you which end I'm at. Take a guess. During December and January, we had over 125 patient posts on there, either asking questions, looking for advice, support, or just sometimes often just simple reassurance, sort of questions like, I've just started taking this, I'm having this sort of side effect, is this normal? We get a lot of that sort of thing on there, and there's always people willing to answer. We don't really have to do a lot on there. What we do is we post up a lot of infographics. We share posts from other respiratory organisations, any requests for help from, I know one of the presenters that's coming on after me, we helped her a lot with her project. So we try to put patients with researchers and patients with organisations who are looking for some help, or they want to talk to patients. And obviously we use it to post about our fundraising events as well, and try to get people involved in that respect. We also have a YouTube channel, and on there we have a huge catalogue of videos. I've just put a list of a few of them here, but it's not complete, it's not comprehensive. But there are things on there, for example, when people struggle with their health, whether that's looking what sort of diet should they have, or struggling to put weight on, which is very common. So there's an interview with a dietitian there. We also do have the information that dietitian gave us on our Facebook profile as well in our files. Very important is your airway clearance and the importance of physiotherapy. And there's a couple of videos on there about that. We have a discussion with a doctor about drug-resistant Aspergillosis fumigatus. And our recent latest video on there was in the same topic, antimicrobial resistance, what is it? Was an interview with Vanessa Carter of the AMR narrative. And she's actually a victim of AMR, and she's created this wonderful charity called the AMR Narrative, who are doing their utmost to raise awareness of it. I think Dr. Anand Shah has been mentioned before today. I think somebody talked about him this morning. We had a question and answer session with him, so we went out to all our patients and we asked them for their questions and what did they want to know, and we put all those questions to Anand, and he very kindly answered them all for us on video. He also did a video on current and future therapeutics in ABPA. Based on this morning's presentations, it might need updating. There's also an interview on there with Professor Darius Armstrong-Jones, Help I Have Aspergillosis, and I noticed that he wrote both of the papers that that Chris talked to us about this morning. And there's a conversation with Professor Denning. For those of you that have been around long enough, he may well have been your consultant at some point. He was certainly mine. And he's obviously retired from clinical practice now, but he is a professor of infectious diseases and global health, Gaffy, and he very kindly did an interview for us on there, which is really worth a watch. So there's a whole range of things on there that our patients can go to when they're looking for some help or some knowledge. And last but not least is the Aspergillosis Trust website. So we have this wonderful website. It's probably very, very similar to the NAC's. The website is there to help new and existing patients. It's there to raise awareness. We have a lot of information in there. I had a look at some of the information, some of the analytics. We had 316 unique visitors between the 1st and the 29th of January, which I was pleased to see. 761 individual page views, which is great. It means people aren't hitting the first page and then disappearing. Over 31 countries access the website, which evidence, if ever there was, that there are a lot of people out there from different countries. And one of the biggest areas that people went to was our patient stories, which is a big part of it. We have an entire area of the website dedicated to patient stories. We get media requests about the patient stories, wanting to be put in touch with those patients. A lot of information is found from there, but it's really good for patients to, as we've already experienced today, hearing Mick and Marcella's, in truly inspiring and important stories about their own individual experiences. That part of the website, it's not surprising that part of the website is very busy, because people just want to feel normal, and that's when you're reading about other people's stories and they're talking about the same things that you've experienced and similar experiences within hospital environments and with family and friends. It normalizes it for you, and that's really, really important. Another part of the website that we added last year, which we were really proud of, is we've prepared patient leaflets. We've got 6 in total, and 5 of those leaflets we were able to translate last year into 30 different languages. So the only leaflet we haven't managed to translate yet is the medication one, and that is something that we would like to do, but it's very costly. But we got 30 of them translated, and they're all on our website, and they can be downloaded. And on that image, I believe that one in the top corner is Urdu. I just plucked from one out of there, but yeah, so they're all easily accessible on there. You can download them so that you've got the information yourself, or you could download them to give to your doctor or your GP. Okay, so I've talked about how we support patients through our socials, but In addition to that, we also do a lot of patient advocacy and collaborative work. So I'm a member of the European Lung Organisation's Patient Advisory Group, along with Graham, and I also represent that PAG at the United PAG meetings. And we're doing quite a lot of work at the moment, and more information will be coming out about that very shortly. We obviously try to do as much as we can with the National Aspergillosis Centre, and this is great. I'm here today. And also we work very closely with the Royal Brompton Hospital and the Imperial College London. We work very closely as well with Global Allergy and Airways Patient Platform, and they've supported a number of projects for us. They are supporting World Aspergillosis Day today, and they've got over 20 of their members sharing all the socials, which is brilliant. I'm really looking forward to seeing the effort that's been put in. We are members of AMR, antimicrobial resistant patient groups, both in the UK and in America. We are members of an organisation called National Voices, which is a leading coalition of health and social care charities in the UK. And they're an amazing organisation, and we get involved in some really low level grassroots stuff that's going on, and that's really good. And we're basically the patient voice. We have worked on a number of campaigns with Pfizer, and one of them which is being rolled out is this one in the corner. I don't know if you can see my cursor, possibly not, but Unmask the Danger in Disguise. That's a poster that's been created by us, working with Pfizer and another organisation. Interestingly, this particular poster has recently been entered into a competition within the industry, and it's been shortlisted. And for anybody who's at the meeting today who remembers the force to be reckoned with Jill Fairweather, she was part of that project, and the award, sorry, how would you say this? The entry into the competition has been done as a dedication to Jill, and in her memory. So I'm really hoping that wins some industry awards. And those posters are going out to GPs, and there will be a whole social media campaign alongside it. So watch this space. We take part in the medics at the Student Voice Prize with the medics for rare diseases and the Rare Beacon. And obviously other awareness campaigns that take place in the same way that you guys do, because aspergillosis tends to affect people with other respiratory conditions. Then obviously we dedicate ourselves to making sure that we cover bronchiectasis, COPD, pulmonary fibrosis, the whole range. They're all there, and we try to share as much information, and so our patients can be aware. Last year on World Aspergillosis Day, I wasn't in this hospital, but I was in the Blackpool Victoria Hospital. I wasn't attached to a drip either. I was stood in the foyer with my colleagues, who you can see in the picture there. Katie and Sharon is our wonderful treasurer, and they and I were stopping the public and medical professionals and making them take leaflets, making them listen to us, giving away badges and stickers, and basically just trying to raise awareness of aspergillosis. And Katie, who I mentioned before, fantastic trustee, Katie, very kindly in the freezing cold December, put a stall up in the north of England in Fleetwood and tried to flog some of our awareness materials, ready for little gifts for Christmas, but also raising awareness. And she had a lot of traffic to a stall that day, and it was hugely successful. So we're going to do that again, and I might help her, but only if the weather's nice. Okay, so what does the future look like for Aspergillosis Trust? Well, we have got a whole range. That's just a few. Our business plan between now and 2026 is massive. We're very small, but we have very big ideas. I'm not saying that we're going to achieve all of these, one of the ones that it was on our action plan and we have actually achieved is to get a fundraising pack together, and that's just a little A to Z of ideas from our pack there, and that's available on our website. But obviously we want to continue to do what we've been doing. We want to continue to engage with patient organisations, and we want to continue to raise awareness. As I mentioned before, we are creating this book. We want to understand more about the impacts of air pollution. I attended the air pollution conference last week that the European Lung Foundation did, and it was fantastic. Definitely got, you know, some impacts on us. We want to be able to create a specialist list of physiotherapists that can help with airway clearance techniques. If we can create a register that we can help our patients go to, then that would be great. We obviously need to deepen our understanding of mould in homes, and that is a campaign that we've been working on for some time now, but there's still a bit of way to go. And we are hoping to create a gardening leaflet. That's part of something that Graham and I are hoping to be able to do with the European Lung Foundation, to help patients still be able to enjoy their garden or plants in their house, but to do it safely. And we are really hoping that in the next 12 months we will be able to get a video out, that a promo video that raises awareness of aspergillosis to the general public. Yes. Okay. So how do we support patients? Well, by letting them know that their voice matters, our voice matters, the patient's voice, it's very important, but we will be your voice when you can't. So as I said before, we will attend conferences, we will collaborate with organisations, we will focus on campaigns, and we need your stories, inspiring, informative, important, sad. Share your stories with us. Let us get them on the website. Talk to us, tell us what you want. This, as I said before, the family from Ireland, they came to us and they said, we need information to be able to tell our grandchildren, and that's what we're doing. If you tell us what you want, then we will try to do it. We will be your voice when you can't. Thank you.
Thank you very much. That was really interesting. It sounds like you've got a huge amount of different things going on.
We have. We're busy.
Yeah.
Hence I'm working from hospital.
And I think, yeah. I know, thank you so much. You're a trooper. You really are. Yeah. Yeah, if anybody wants to get involved in anything, these things, then yeah, go on their Facebook and volunteer, because the more the better. The more the better.
Definitely.